it's totally possible to be healthy with implants. It's also possible to be teetering on the edge and to totally bring it back if you have the right support. What my formula does is my formula, it's really made for like people who are healthy with breast implants. Part of the reason why is because, you know, with a supplement, you're not allowed to treat illness. That's a really big no-no because only drugs can treat illness in this country.
Let's ditch the quick fix and dive into today's conversation. Welcome everybody. My guest today is Dr. Kayte Susse. Dr. Kayte became interested in studying pathophysiology through her own battle with misdiagnosed illness. Despite her active lifestyle and athletic background as an All-American high school and collegiate wrestler, Dr. Kayte began suffering from a sudden onset of systemic health issues that perplexed both the allopathic medical community as well as several alternative medical doctors. This led her to chiropractic school and then functional and regenerative medicine, where she was able to discern the root cause of the problem as toxicity due to breast implants and mercury amalgams. Inspired to help others facing similar predicaments, largely unacknowledged by the traditional medical community, Dr. Kayte began her journey into the world of natural health. Her work is changing the course of the way we look at mitochondrial assaults from the environment, man-made drugs, and pharmaceutical devices. Dr. Kayte is a chiropractor, television host, and a supplement startup founder in Los Angeles, California. Welcome, Dr. Kayte. I'm excited to have you here today, and it's such an important topic to have a conversation about.
Hi, thank you so much. I'm so excited to be here and talk about all the new ways we're thinking about toxins.
Awesome. That's great. So why don't we start by having you give us a little bit of a history on breast implant illness. I don't even know what the prevalence is, frequency, occurrence, those types of things. But if you could kind of get into that a little bit and share what it is and what's happening.
Sure, absolutely. Well, I think talking about the history of breast implants by themselves is what is most fascinating. A lot of people don't know. When you read the natural history of breast implants, it's really jaw-dropping, and you might wonder, why are these on the market? But they're on the market because there's a demand and there's a huge desire to augment, whether it's breast implants or some other form of intervention. And it seems that this is just human nature. It's nothing particularly crazy about our culture in this moment in time. It's linked through all of history of man in cultures all over the world that we have this desire to augment, and based on the society and the culture, it varies, like whether it's putting an implant in a part of the body to create a certain shape or some other bizarre thing like foot binding or like extending the neck or there's so many bizarre things that we've done as humans. So when I started this journey, I was really critical of breast implants, and I've started to feel differently about it and just feel like, people do what they want to do, and we have to sort of support them and meet them where they are and have the best available information and give appropriate informed consent, such like as if there's toxins or chemicals in something or potential to cause illness, perhaps that's something you should tell someone when they decide to get breast implants, and let them make that decision for themselves, right?
Sure.
Yeah. So back in like the late 70s, 80s, and early 90s, we had breast implants in the United States that were really, they broke apart very easily. So the silicone was really migratory. And when a lot of women came forward with problems, in fact, there's an episode of Oprah, which I believe was shot in 95. So it was after the lawsuits, but they even had, I believe, like the ethics, it was like an executive at Dow Corning, which is the manufacturer of silicone. His wife was one of the first recipients of their silicone, and she suffered tremendous health problems. And they were able to show the silicone was migrating down her ribs and, into the stomach area. And they went on Oprah, the husband and wife, with the CEO of Dow Corning, which would never happen today. It was pretty amazing. You can find this episode on YouTube, talking about these problems and how they came forward, but there was a huge lawsuit, and it was pretty easy to prove that the implants were not functioning as intended because they were breaking apart. So that lawsuit was won by the plaintiffs, which were the women who were injured. But they never really had to prove. These women all had systemic illnesses. They had neuropathies in their legs. They had pain syndromes. They had autoimmune diseases. But none of that was really ever proven because they didn't have to prove that. They just had to prove that the implants weren't functioning correctly.
Okay.
So at that time, a major payout was done from the major manufacturers. Also, Dow Corning did some kind of interesting things because there was a parent company, Dow Chemical, or I might have that flipped. But in any event, they moved around things, and so they paid out a lot of money. The FDA decided to remove the silicone-filled implants from the market. So they were off the market from 1992 to 2006. And unless you are a mastectomy patient, in which case they made an exception, which looking back is a little bit mind-blowing because if you're a cancer patient, you could still get breast implants. Probably the worst patient to get.
Yeah, why would you want to do that?
Because again, they never
Right.
really proved that it was causing systemic illness. They just proved that it wasn't functioning correctly.
Sure.
So around 2006, two companies were in the United States were able to present new studies to the FDA and new formulations where their primary concern was creating cohesive silicone to prove that it didn't break apart. So when they presented those studies to the FDA, they said they were 3-year studies. Okay, that's it.
Okay.
And it showed that the implants were very cohesive, that you could run them over with a car and they wouldn't break. You could stab them with a high heel. In fact, I think they did commercials showing that.
Oh, interesting.
And then I'm not certain about this, but they probably were presenting that there was still a demand. So the FDA gave them approval and told them to finish their 3-year studies. They're supposed to be 10-year studies.
Medical information has become tough to sort through. Between politicization, institutional bias, and mass media, it's become tough to find the things that lead you to getting healthy. The Unaverage Health Summit is a free online video event for people seeking natural methods to kill brain fog, eliminate bloating, blast fatigue, and live optimally. You'll get access to discussions with natural health experts like Dr. McCullough, Dave Asprey, Dr. Petros, Dr. Schaffner, and many others on the cutting edge of medicine. It's happening soon and only available for a limited time. Go to unaveragehealth.com to get your free ticket to this online event. That's unaveragehealth.com. Again, it's free and access is ending soon. This is a great opportunity for you to continue your journey to becoming the best health advocate you can have. Hope you take advantage of this.
In those 3-year studies, there was like an intentional elimination of anyone with autoimmune disease or a family history of autoimmune disease. But they still found that 1 in 300 women developed anti-nuclear antibodies in the 3-year studies. But I guess for the most part, it seemed like they were safe. So, they got their approval. They never finished the 10-year studies. So the ball was totally dropped on that and they were put back on the market.
Okay.
What we do know is that in the last 3 years, we have had massive, amazing legislative changes that I have to give credit to the FDA for what they've done in the last 3 years. Of course, it was all due to advocacy from hundreds of thousands of women and also like hundreds, if not thousands of reports. Maybe it's, I should have that stat, but I'm like more in the medical, like biochemical side of this. And there's women who work really in advocacy and know like these stats way better than I do. But there were whistleblower reports that were released of adverse events and lots of things were reported. So anyways, a lot of that stuff was presented. The FDA has now instructed those pharmaceutical companies to finish their studies. So they're supposed to now be finishing them. The FDA also put a black box label on breast implants in 2020, which is it's the most severe label a drug or device can have. It means it can cause death. And in November of 2021, the FDA mandated plastic surgeons to update their informed consent. So now the informed consent includes the list of risks such as cancer, which is the breast implant associated large cell lymphoma. It's a type of lymphoma that's only seen in people with breast implants.
Okay.
Also to speak about systemic illness in the informed consent. So massive, like amazing. The surgeons now have to do this. If they don't do it, it's malpractice. I don't know if every single one of them is doing it, but I do know some that told me for sure they had to update their informed consent paperwork. And, I'm assuming that they're doing it, right? So that just happened. It's a pretty big
Well,
deal.
that's definitely a very good progression for sure from 2006.
Oh, absolutely. Yeah. Because up until like when I explanted in January of 2018, if you went and you did a survey of surgeons and you went and talked to all of them, hey, I have breast implant illness, they would say, that's not real, you're crazy, and many other gaslighting.
Right.
So
What
most of them.
what has been the prevalence of implant illness? What is the prevalence?
Well, I don't think that I can answer that question because,
Okay.
well, for one, it's very hard to study when you don't have the people who are funding these types of studies, like you mentioned earlier, are pharmaceutical companies that, they have a vested interest in financing those
Sure.
types of studies. I can tell you that the breast implant illness support group, the main one, has over 100,000 women in it.
Okay. So
But
a lot of patients have come forward. A lot of doctors have recognized the toxicity and, have at least attributed, the implant as a potential factor in an illness, a new illness, and different illnesses that are associated. Is that a fair statement?
I think that it's vastly increased since at least when I was sick, which was not that long ago. When I was very ill and looking for answers and couldn't figure out why I was having all these health problems, like not a single person. I went through all of chiropractic school, seeing tons of clinicians, and no one ever asked me if I had breast implants. It wasn't even on their radar. So I think it's definitely getting on the radar, which is pretty cool.
Really, very, very exciting. So let's go ahead and go into your personal story if you're okay sharing, what happened. I know this would be helpful for our listeners.
Yeah, absolutely. And just to answer your previous question, I just thought to say that I think when we're thinking about how many people are sick with breast implants, it's important to also think about how our culture and society and environment is becoming more toxic. So
Yes.
there's that component is,
Yes.
uh,
So many environmental exposures, and that's another one. And anything you put into your body is going to have the body's going to react to it, positive or negative. So, that's kind of really what we're talking about. We're putting some kind of a foreign material into the body, and what's the body going to do with it? And it's going to be different for every person, and their individuality and all of the different, genetic, epigenetic realities come into play. So it's an interesting and complex, conversation.
right. So exactly. So everyone doesn't react the same. What I've observed is that there are people who have genetic predisposition towards autoimmune disease. I was not one of those people. I fit more of the toxicity model. And you can be both of these things at the same time. They're not mutually exclusive. But if you,
Sure.
if you have a strong autoimmune tendency and you put any foreign body in your any foreign device in your body, whether it's a silicone implant or a saline implant, or some other type of implant potentially, you can turn on autoimmune diseases, right? You can flip that switch. It's a trigger event. And if they have other gut issues, or, a lack of those glutathione recycling substrates, or a lack of the precursors to the T regulatory cells, which help to balance like the autoimmune response, then they put a breast implant in their body, it can, turn on an autoimmune disease. And similarly, if they already have an autoimmune disease, like something maybe like, I would say like Hashimoto's, which is super common.
Okay.
If they're dealing with something like that and then they get a breast implant, it could be very difficult to downregulate that disease, because it's a trigger. And then in the case of toxins, that complicates the picture. And then there's other people who it just seems like they already had quite a high toxic load prior. And what I figured out, which is like the basis of this formula, is women who, and I fit this picture, people who have a high toxic load typically are skewing in the direction of collagen dysregulation, which is a function, like you mentioned earlier off camera, it's a function of the mast cell system. It's the reason why mast cell syndrome is very closely associated with hypermobility.
Mm-hmm.
Hypermobility, it's a chicken and egg thing. If you have genetic hypermobility, you're likely to have reactive mast cells, right? But if you have reactive mast cells, you're also very likely to have hypermobility that's caused by the histamine breaking down collagen, okay? Because histamine breaks down type 4 collagen in the skin matrix and in other parts in the gut. So it's very interesting. These people that turn on a hypermobility collagen dysregulated pathway due to chronic exposure to toxins, pathogens, allergens, usually all of them, right? They don't make the best quality integrity of scar tissue capsule around a breast implant.
Okay.
And that can manifest as too much, which is quote unquote capsular contracture, which is why surgeons typically give steroids for capsular contracture, because they understand it's a function of the immune system. But it can also manifest as too little. And when it's too little and it's too thin, the immune system can get into a breast implant very easily, and it can phagocytize, it can engulf microsilicone, which has a chemical and heavy metal profile, and it starts mobilizing those toxins. So a person who has pre-existing toxicity, typically their detox pathways are operating at like half mass. So they might be okay, they might feel normal, but when they're already having these challenges and then they don't make good capsule of collagen, and then the body gets into the implant faster, and then they have an onslaught, a ton of chemicals and toxins coming in from the microsilicone. And remember, this is a 24-hour a day, 7-day a week onslaught. There's no break.
Right.
Whereas in our lifestyles, in our toxic environmental lifestyles, typically we're still getting breaks, like when we're sleeping. Hopefully, unless you're sleeping in like a moldy house or whatever.
Right. And maybe you turn off your Wi-Fi, and maybe you're able to manage those things, but you can't manage what's happening inside your body. Exactly.
Right. So when you see this person, this clinical picture, and all this intense load of toxins is coming into a body that's already detox challenged, that's when you start seeing these epigenetic switches flipping really fast. And it can look like so many different things, because like you said, it's very bio-individual. So while there are common threads that we can see, typically there are common threads about detox, like, the kidneys, the liver, like what are symptoms that are associated with burdens to lymphatics, like blood flow, like thyroid, swelling, rashes, but sometimes it can look like really weird things, like wild card things, because it's that person's bio-individual epigenetic switches.
Sure.
So maybe they wouldn't turn on a disease until they were much older, but now it's happening when they're much younger. And so when they go to try to get help from their allopathic physicians, typically, or even untrained holistic natural doctors, it can be sometimes really confusing.
Mm-hmm. Right. Or oversimplified.
Yes. Or they'll go straight for like detox things, which make, if they start trying to clean the gut right away, then they just get sicker because they're not addressing toxicity, right?
Right. Exactly.
Or low grade pathogen infections or viral activations and all of that stuff. So
yes, which is so important to have somebody that's, very integrated, very knowledgeable on understanding, to try to address the individual and all the different elements. It's detox is always great, but not necessarily, until you get something else taken care of. And so that is part of the puzzle for sure.
Yes. So I know I went a different way. I apologize. I know you were asking me about my story, but
that's okay. That's okay.
That's kind of what happened. Although it didn't look like such a nice, straight, obvious thing. I had no idea what was going on. So Dr. Jack and I were talking last week about hypervigilance, which loops back to what we were talking about.
Right.
Speaking. He created this really phenomenal chart that shows how hypervigilance, which really, like, if you're looking at the chart, I would put it, so prolonged hypervigilance, and then I put right next to it maybe like sympathetic dominance, but maybe like they're coming in and together, not exactly a perfect line, but that clinical picture is the reason why people who get exposed to toxins don't detox them, right? You have to be relaxed, prolonged relaxation in and out of also being in fight or flight. It has to go back and forth over someone's life in order to eliminate these chemicals and toxins. So if you're not able to do that, or you're skewing in one direction, you're going to be a person that accumulates more heavy metals and more toxins.
Yeah, so you're just not having that ability to get out of the sympathetic into the parasympathetic where you need to be for rest and restoration, which is where, if I'm following correctly, the ultimate opportunity to detox well is in the parasympathetic state.
Absolutely. So this is very important because we're talking about years and years and years, and we're talking about an entire like road of building over your life. So it obviously doesn't happen overnight.
No.
But you take someone in their 30s or late 20s that now has a huge toxic exposure, right? And then they can't recover. And then you see someone else who has the same exposure and they do fine. Why, right? Well, that's the reason.
Yeah, and it's somebody that's hypervigilant, the type A, going to go, is going to have more of a challenge than the person.
And so it's interesting when you start researching what hypervigilance really is, you see a lot of definitions that make it sound a lot like PTSD. And I don't fully agree with that. I think that it's I think in this particular type of patient that we're talking about, and we're talking about these people that you meet in the chronic illness communities who, and you can see it that they have now applied the hypervigilance to their health condition, and typically in a way that is really sophisticated. Like they know more than all the doctors they've seen, right?
Mm-hmm.
Because it seems to be that more often than not, these people have, I want to say like a hypercompetence, which is associated with high functioning IQ. And I believe that this is probably related to in utero exposure to excitotoxic heavy metals like mercury. I believe that people who are exposed in utero to something like that, and then also keep in mind that if the mother is passing mercury, it's very likely that she herself has a hypercompetent personality or a hypervigilant personality, which potentially has an effect on the child's personality. It's very interesting because you can tell someone to relax all you want, but you have to realize that mercury is a central nervous system toxin. It's priming your body. It's creating hyperreactivity at the level of the nerves. This isn't something that you can just say, hey, go do some breath work and calm down and do some yoga and relax. It's not going to happen. And it's okay, because what I'm learning is that you might not ever be able to change something about yourself that's very pronounced, but what you can do is you can learn to strengthen the opposite qualities. So that's
there you go. I think that's a good way of putting it. That's very good. So coming back into a couple of these, details on silicone itself, is that the only? I'm going to switch back just a little bit, kind of circle back a little bit. Is silicone the only material that's used in breast implants, or is there other materials that are used?
No, it's silicone. It depends. So if it's a silicone filled gel implant, it's going to have like silicone, which is a derivative of silica, which is a derivative of sand, which I don't know, sounds natural. It sounds fine, right? But the problem is that they're adding other heavy metals
All
and
the chemicals.
Yeah. And I think that the newer, most cohesive implants have more chemicals than ever because of like the attempt to create more cohesiveness.
So yeah, so it's more stable. You can run over it. You can step on it, do all those kind of things. But they really still probably have, like you said, there's the different environment that these implants go into for every individual. And then there's still some type of a concern, or is there a concern for any leakage from the implant itself, or has that been totally addressed well by the manufacturers?
So what we find is, especially in these patients who have very thin capsule tissue, when you remove the implant, you can find that it's very sticky to the touch, or sometimes it won't be too sticky, but if you leave it, for 3 days in a bag and then take it out and touch it, then you feel like it's almost like it's perspiring. So that's what they call gel bleed. And gel bleed, it varies depending on like the aggressiveness of the body getting into the implant. So I don't think that the implant is actually sweating on its own, although maybe it is to some extent from the heat of the body. But I believe that they did a lot of tests outside of the body using, I'm assuming they used like these extreme kind of conditions to test how much it would sweat. And in the FDA, in the fact, I'm not sure if it was in the, no, I think it was in the pharmaceutical fact sheets.
Okay.
But I think you can find it on the FDA website. They talked about gel bleed, and they talked about the contents that sweated. And then they tested what came out of it and found that there was clinically insignificant amounts of things sweated. So that was part of them thinking, it's safe. But again, if the immune system is getting into the implant, I mean, all I'm saying is potentially the body is not so hot that it's making it sweat on its own. But if the immune system is pulling off little pieces of microsilicone, for sure that can contribute to gel bleed, or that is the cause of gel bleed. And I worry sometimes about women. What I've seen a lot of is women who have implants that feel a lot of these detox challenges tend to like love to do infrared sauna, and it makes them feel better temporarily. But I worry about that exacerbating gel bleed as well, although I have no actual evidence of it.
Well, yeah, it makes sense. If it's heating up the body, is it going to cause more uh, instability at the implant and surrounding tissue? What are the common findings in blood work? I mean, does it have an impact on testosterone? Does it have an impact on thyroid? The blood work itself. What do you see connected, at least associated, correlated, even if it's not causal? What do you?
I would say that the most common presentation is that the blood work comes back normal. So
Okay.
unless you're doing like a very, very deep dive, like functionally, and running, excessive labs to find irregularity, typically like if you do your basic, allopathic panels, like the thyroid will be normal. You might get lucky and find someone with antibodies and figure out that they're going in an autoimmune direction. You might see like a road to insulin resistance. You might see prediabetes if it's really bad. For sure, like toxins can have an effect on the mitochondria and the way that we process insulin and glucose
Mhm.
and but it's not like you're not going to be seeing like, oh, the liver is elevated. It doesn't look that way. It's very subtle,
Okay.
especially if a person doesn't have a disease. So this is so interesting. This is why when I remember when I was in school, and this is when the first time I realized that my breast implants could be a problem. I saw a couple studies. I was at a seminar, and the doctor that was presenting put up studies about silent rupture in silicone implants being associated with fibromyalgia diagnosis.
Okay.
And why is that important? Because like, if they have fibromyalgia, that means they don't have rheumatoid arthritis, lupus, scleroderma, or one of these other autoimmune diseases that causes pain syndromes.
Hmm.
They just have like a mystery pain syndrome.
Right.
So
Right.
it's very important. So for sure, like they are presenting with pain and tender points, but they don't know why. And that's not necessarily going to be something you can find on a blood test. I hope I answered your question. I wish there
No.
was a better answer.
No, no, that was perfect. And that's, it's one of the things. I have a family member and they have, recent implants, and some of the blood work came back here recently, and I was kind of wondering, would that have an impact? And it may or may not, but there just might not be enough data to know if there really is, something like that happening. But like you said, there's just no smoking gun that you see on blood work.
Not unless there's like clear cut like autoimmune presentation happening. So I would definitely look for that if I was treating someone that had breast implants and had some of the hallmark symptoms. I think it's really important in these patients to take a mercury history and to do a deep dive into like what type of personality they have, like we were talking about
Right.
earlier,
Right.
what their exposures are, and thinking about those things.
And so what, you just kind of touched on something and just maybe expand on it just a little bit more. There's a couple other areas I want to jump into, but before we go there, what are the hallmark kind of symptoms that you've, been able to collect for people that are suffering from the implant illness, kind of fatigue,
For sure, for
pain?
sure, for sure, fatigue. Well, like, so if we look at the chart that Dr. Jack made, which is, we're talking, so we already discussed like the road there, this prolonged hypervigilance, sympathetic tone, and then people start to get what we call brain dysfunction, which is like accumulation of toxicity. It starts to interfere with neurotransmitters. That could be brain fog, right?
Right.
Brain fog is obviously closely associated with the gut. So simultaneously, the body is suboptimal. So you could start to have dysbiosis, and you could start to have a slow infiltration of pathogens, potentially in the gut, parasites. You could also start to express chronic reactions like chronic reactive viruses. So like, things like EBV that are not, the immune system starts dysfunctioning. The patient is not necessarily regenerating in sleep. So the
Again,
body,
going back to that sympathetic tone. Right.
yeah, the body is like becoming more catabolic. It's not regenerating itself. So then when you look at, so I'm just going to read from this because this is like, you're asking me what the symptoms are. So endocrine dysfunction, this is not just breast implant illness. This is chronic illness skewing towards chronic fatigue syndrome. And this is going to be a spectrum. So not everybody is like, I can't get out of bed ever. And if I, get excited, I'm in crash for 3 days. It's not, everyone's not that, but these are like features, and you can see it's a spectrum. Okay. So we have endocrine dysfunctions, which is going to be thyroid, adrenal, insulin, low body temperature, circulation, digestion dysbiosis, which we talked about, malabsorption, leaky gut, potentially liver and kidney dysfunction, which can manifest as swelling or like rashes or intolerances to things, alcohol, things like that. Things that used to be tolerable are suddenly now no longer tolerable. What else is there? He just says viral infections, bacterial, fungal, parasitic, and then of course a dysregulated immune system. So more reactions, more allergies, more inflammation. And then they may also have musculoskeletal arthritis. So anytime I'm a chiropractor, so like we learned a lot about, like, so interesting when people have really bad arthritis, like not everyone has pain and problems. They could have horrific x-rays, but not present. And then you see, so why? Well, heavy metals love to form mineral crystals. Like they bind with minerals and form mineral crystals in fascia. So I find that in a toxicity patient that they have a pain focal area. It's typically related to heavy metals in that area.
Right.
Yeah. Okay, so that was all of it. We did it all. Did I
And
answer?
you experienced some of that yourself as you went through this, and you're trying to find answers with the medical doctors, with chiropractic. All those things were not really satisfying where you were at, and so you experienced a lot of these same symptom patterns.
I had like extreme pain, chronic pain, and extreme, like, just it would, you mentioned my wrestling background. So yeah, I have a pretty, like, a lot of wear and tear on my spine from wrestling. And well, now learning about tongue tie, I was wrestling with a tongue tie, which is, don't do that if you're that's like a good way to get your spine really messed up. Because speaking of hypervigilance and tongue tie, this is what I'm most interested in right now. I know you think it's not super silicone related, but tongue tie is so common. And if you have a tongue tie, your neck is pulled forward. So you're
Impacting the lordosis.
Well, impacting the sympathetic chain.
And the sympathetic chain.
Which creates priming, which creates a stress state. And it's going to exacerbate your ability to detox and heal and sleep well. You don't regenerate, you don't get,
right.
It causes mouth breathing, which means you don't get the nose during sleep is what's pumping this cerebral spinal fluid to kind of like wash the brain. So there's just like so many aspects to why that is an important thing if that's going on, to address that. But for sure, I was wrestling with it, and my neck, I had all this pain. I had no idea why. And that's why I chose chiropractic school. I thought I would learn. I thought that, in my naive understanding of the way the body worked at that time.
Sure, sure. And you had I think if I remember in prep for this interview, I think I saw an X-ray of your cervical spine that wasn't so good.
No, it looks like a 65-year-old person at 28.
Right,
Not 28 anymore, but
right, right.
I think when that X-ray was taken, I was. Yeah.
Okay, so yeah, so you kind of battled through that, and then you've been able to. You went through an actual removal or explant,
Mhm.
and did you notice that your symptom patterns really changed fairly quickly, or how did that go for you?
Well, no, actually, I think that I was quite sick after explant. I
Okay,
think I got even sicker, but
okay,
that was a feature of my like extreme toxicity and if you're cleaning a cup of water that's like has like stuck stuff on the rim and then you start scrubbing it and then the water gets really dirty, right? So
sure,
I was also, there were many things that I was doing all the wrong things.
okay,
I didn't know I had mercury toxicity. So I was taking things that I thought were supporting my liver that were really moving around mercury, like glutathione. Glutathione's amazing, but it can be really bad in the wrong timing of detox
like
for a certain type of patient.
yeah, and that's what we were saying a little bit earlier. You need to get in with that doc that really kind of understands the best way to approach the whole system, and it's not easy to find those integrative doctors that are up to the latest, on information. And I know I'm not personally. I am a chiropractor, and I stay in my lane, and then I refer to people like you and others that are doing some of this deeper dive, and it's so important to do. The next question would be, there's one way of trying to address a toxic implant, and that is to have it removed if you feel like it is what's happening. And then the other is how can you be healthy, and is it possible to be healthy with the latest generation implants, or what are your just general philosophical thoughts on that, and or actual physiological thoughts?
Okay, so that's like four questions in
I
one.
know. Sorry.
Okay, so I don't know where I want to start. Yeah, it's totally possible to be healthy with implants. It's also possible to be teetering on the edge and to totally bring it back if you have the right support. What my formula does is it's really made for like people who are healthy with breast implants. Part of the reason why is because with a supplement, you're not allowed to treat illness. That's a really big no-no because only drugs can treat illness in this country.
Right.
So, but what this formula does is that it's addressing three components of like someone's body, and it can be really, really pivotal if you can get this formula before and during the implant process and then right after, because that's like when your collagen tissue is forming around the implant. So if you could take this for 6 months before you got a breast implant, it could have a big impact. Like if you're already skewing towards hypermobility and collagen dysregulation, it can have a big impact. Reason being, an entire sleeve of the formula is it aims at down regulating the MMP9 pathway, and that's the pathway that like it involves when mast cells are too primed and they're hypersecreting histamine. It can really strengthen the integrity of the mast cells. It can dampen histamine, and it can change the way your collagen expresses.
Okay.
So when I give this to people, sometimes they tell me right away that they notice their skin looks tighter, but even like their systemic skin, because it's helping. It's basically collagen. When we think about collagen supplements, we think a lot about giving people building blocks for collagen, and this works on collagen way downstream because I'm hesitant to use the word preventing, but it's supporting the prevention of the breakdown of collagen.
Okay. Yep. That's a good way of putting it. I
And
think
if,
that's safe.
I hope so. And if the person already has breast implants, it can really support that system as well. And it can also support the immune system with regard to supporting the body in the ways that are important when a person needs balance in their immune system. So when we think about autoimmunity as being
Hmm.
too high, and we think of HIV as being too low, and it's not true. It's like a dysregulate, like autoimmunity is really like a dysregulated immune system. So it's like we're providing balance to the immune system, and we're providing all of those substrates that you might be missing if you have leaky gut. Okay. And then there's also
yes.
there's also another sleeve of the formula that supports the elimination of xenoestrogens, which is super important. It's going to give you like obviously your methylated forms of B12 and B9. So if the person genetically has MTHFR mutations and it's an impediment to detox, although secretly I think the impediment is really sympathetic tone, but both are important, because if you have both of the, if you have both of those, it can be a problem. A lot of women with breast implant illness have MTHFR. That's something we've like anecdotally, figured out in those communities. And so supporting MTHFR is of course important, but we're also helping to eliminate xenoestrogens, which are chemicals that act like estrogens. And when you combine things like calcium D-glucarate and vitamin A, like there's studies showing that prevents breast cancer. Breast cancers that can be driven by estrogen dominance. So there's a whole sleeve that's helping with detox too. So, but yeah, it's the company is very new. I launched about 6 months ago, and yeah.
Okay. So. What are some of the ingredients within it? What is kind of the...
So what's important to know is that these ingredients work in synergy. So if I start listing them off and then people think, oh, I'll just take this and that and it'll work. Well, basically there's three categories. One is an immune modulation category. So we're looking at all the substrates that recycle glutathione, and we're looking at fat soluble vitamins like A, D, E, and K, which are like foundational for supporting the T regulatory cells, which are the cells that decide if a tissue is like a pathogen or not. So if your body presents a self tissue and says, hey,
right,
Damon, we think that this piece of your joint is a pathogen, and then your body agrees with that antigen presenting cell, then you're going to make antibodies against your joint. But we find that happens in people who are missing, who one have genetic predisposition, two have leaky gut, and then three are missing those substrates for glutathione, things like glutamine, vitamin C, other things. And I also was really careful wherever I put sulfurs, I added like things that would balance them. Like I put PQQ, a very small drop, with the glutamate intentionally, in case people react to those things, even though it's such a low amount. I doubt that, but in these toxic communities, I see that. So the second part is the collagen modulating MMP9 dampening mast cell side. So that's the side that's giving you all the nutrients that help to downregulate MMP9, support mast cell integrity, and support the collagen so that it isn't broken down by histamine.
Yeah. So basically calm down that mast cell activation, try to keep it from overreacting and over histamine. Yeah, so good. And
yes.
then the
third part is the detox support. And so I'm not pushing detox. So nothing in this is going to make you feel like you're detoxing. It's just going to support your methylation pathways, and it's going to support the elimination of xenoestrogens.
Okay.
So a lot of people take this formula that don't have breast implants or silicone devices because they have gut challenges, detox challenges, and exposure to toxins.
Well, and that's what I was just going to say. It sounds to me like this would be a good general support supplement. It wouldn't have to just necessarily be for the implant, but it's one of the reasons why this type of formulation would be positive, is because it's toxicity reality that's people are experiencing specifically with breast implants.
Yeah, it's autoimmune dysregulation.
Right. And so what are some of the other lifestyle recommendations in general that you recommend to go along, with trying to support a healthy system, no matter with or without breast implants, but breast implant illness, considering it?
So I think that one of the best ways to get heavy metals out of your body is ozone sauna, if you can do it twice a week.
Nice.
It's hard to find good ones now. And, I heard like the company you're affiliated with might be making ozone saunas.
Well, they are definitely looking into that as a kind of a conversation or prototype. I think is in the works. So
That would
I,
be phenomenal.
yeah. So that is one of the conversations that they're having as far as the ozone goes. But so you would find that to be the application best in that sauna environment.
Yeah, and if they can do things to support detox prior, sometimes we really do see, we can physically see heavy metals in the sweat, like in the it accumulates in the bottom of the sauna. And I've actually tested them. So I'm not just making this up. I've tested my own sweat. There's like, it looks black at the bottom when you do it. And it doesn't always happen. So typically when you're pushing detox really hard prior, so doing modalities that open the blood flow and relax the body. So things like biomat and vasodilation and PEMF, if you can do those modalities prior to going in an ozone sauna, and sometimes it can take people a lot of times before they start seeing metals come out. But you start to see them on the towel and you see them in the floor of the sauna. Dr. Cowden and Dr. Miller have done studies with the towels. They've cut slices off where they see the brown or dark spots, and they've tested them and they come back as heavy metals. I've tested my own sweat where it was dark and it's come back as heavy metals. So I have no doubt in saying that it does help you dump metals.
Remove those. Yeah.
Obviously, like things like moving lymph is huge in implant illness because you're talking about microsilicone, which is sticky and it has
Mm-hmm.
a hard time getting out of the body. So that's going to be a very important thing. Go ahead. I feel like you have something. Go ahead.
No. That's good. Yeah, the movement, body movements, all those try to keep the circulatory systems working at their prime, right?
Yes. And then again, like we were talking about earlier, if you have any of these structural components that are creating sympathetic tone, like a postural syndrome, like upper cross syndrome, it's massively important to work on that because you want to allow your vagus nerve to, have work with less interference, and you want to take the tension out of the sympathetic chain. But you also have to realize if someone has a tongue tie, they're going to have a really hard time correcting their postural syndrome. And if they have a tongue tie with toxicity over their lifetime and they start trying to move those tissue, they might feel sick. They might get physically tired trying to do postural exercises. So it's an uphill battle, but it can really help. And again, if you have this type A type of personality or this hyper competent hypervigilance, like you have to work on strengthening the other part of your personality.
Very, very good. So, can you? And you've done so well. There's so much good information, and I know we could get into even more depth on this. But how about just if you were to take what we talked about, two summary take-home points, what would those 2 points be for those considering hey, what do I do? I have the consideration of having a breast implant, or I have a breast implant. I'm not sure if it's been positive or negative. What are just a couple of take homes for our listeners?
Okay, the first take home would be to relax and not to get too worried. I don't want to create fear in people with breast implants. There's a lot of movement right now, which is great. I support the movement
Yes.
of spreading the information. And yes, there are many people who are very sick, but when you get information like that and you cannot immediately have surgery and you don't know if it's the right thing, it's important to just calm down and take a bird's eye view of what's going on with your body overall, right? I would say it's very, very important to identify if you are a person with autoimmune disease or if you are a person with a history of exposure to chemicals and heavy metals,
Hmm.
and think about those things in relationship to your symptoms from breast implants.
Perfect. And the tongue tie, I'm definitely going to dig into a little bit deeper because that is an interesting element that you've brought to our conversation today that I was not really aware of the depth of the potential negative impact it has on the physiology.
Absolutely. And there's a lot to say about tongue tie. I mean, you can really correct it at any age of your life and have tremendous benefit, but for sure, children should be checked. But
Hmm.
this is an emerging field, and there are people like Dr. Zaki, who was the one who operated on my tongue. Most of the time, adults, like a frenectomy is not sufficient. They need a frenuloplasty, which
Okay.
which is a deeper release, and then they can really start to get results. And then they have to do quite a bit of myofunctional rehab, like they have to do tongue exercises. But the tongue, in many ways, is the roof of all the musculature in your body. So we find that when the tongue tone is bad, it has a trickle down effect on the whole body. When you look at the brain, the homunculus, there's a disproportionate amount of space allocated to two parts: the hands for function and the tongue. Okay. It's very interesting.
That is very interesting. And, that's, again, it's just, there's more information to the story, of course. And for you specifically, you've been on a brutal journey. My goodness, when I was looking and reading and watching a little bit of what you went through, your health status now, it appears to me to be so much better.
Yeah, it's so much better. But that was actually part of the problem the whole time, was that I seemed like I looked decent most of the time and I could still perform most of the time. But that just is a tribute to my kind of like hyper competence, I guess. And
right. You were faking it a little bit.
absolutely. I remember when I first started hosting my TV show, before I started understanding the mercury component. And I actually figured that out by interviewing a guest doctor, Daniel Pompa, who came and taught me about that. Like all the time, I learned about it. But when I was doing the show, I sometimes do 3 guests in one day, and then I would go home and I would be in bed for 3 days. And that's what it would do to my adrenals, just to function at that, like just to be really, animated. It takes a lot of energy to be animated.
It does. Yes. And so now you don't have that same setback.
Not to that degree, no. But it's still about balance and understanding the body. And I still do have a long way to go with detox. I'm still getting a lot of heavy metals out. I've learned some fascinating new modalities.
That you're going to continue to go down. Yeah. The oral component, the biological dentistry, there's all kinds of ways to, what you're talking about here, with the tongue and its connection and the oral cavity itself. It's just, I'm still learning this, way down the road, and it's fascinating, and it's just really important to try to address these areas for sure. Yeah. So how do we follow up with you, Dr. Kayte?
So I think Instagram is a great place to learn about all of the things I do for improving chronic illness, and also regenerative medicine, which there's a lot of entry points to that. For, you don't have to be sick to want to regenerate. You could just be wanting to look younger and feel younger. Instagram, so at Dr. Kayte, DrKayte. And there you can find links to like the website to buy the silicone support formula and other things. So
awesome. Very good. Well, I really appreciate you being here today. It's such an important topic, like I said, and your experience has led you down a path to seek for the best answers. And you've been blessed by so many good mentors and
yes.
And people in your life. So, and now you're one of those going to be mentoring others. So that's really, really, really awesome. So we thank you for being here today.
Thank you so much for having me. It was so great.
Awesome. Everybody have a blessed day.